Hi, my name's Dr. Esther Cole. I'm the founder and director of a multi-award-winning international team, Lifespan Psychology, the Diverse Practice. I'm a consultant clinical psychologist, life coach and therapy business coach, and the first Black clinical psychologist to receive the BPS Early Career Award. I run individual and group coaching sessions for therapy bosses aspiring to build their team. BOSS stands for Business Owner Support Squad. Welcome to the Breaking Through Therapy podcast. This is the only podcast that supports you to come on the show with your therapist at least 1 year later to talk about the breakthroughs that you've made along your journey and its impact on your life ever since. So this is the Mental Wellness Podcast for people interested in having talking therapy, professionals who deliver talking therapy, and everyone in between. Hello and welcome to Breaking Through Therapy. Today we're joined by the amazing Cris Prade, who is a chartered psychotherapist and has been working as an integrative psychotherapist for more than 25 years. We've got the incredible Kaly, who's here to share her story with you around birth trauma. She's so generously come today. Not once, but twice, because we tried to record this before, didn't we? And really what we want to do is to empower and support as many women as possible who have either experienced a traumatic birth or who have fears around birth, particularly women who have a diagnosis of pre-eclampsia, because there are so many complications and this diagnosis can be fatal. So it's absolutely amazing to have you here today to share your story and to let all of the listeners know that we have a really positive, really successful, really beautiful story to share with you today of not one but two births that were successful, and that there is so much hope. And what I'm really hoping is that by talking to both of you, Cris and Kaly, together, that we'll be able to share your journey and inspire others who may be scared, who have walked in similar footsteps to you, and really find out what it is that works and what breakthroughs can be made to overcome such challenges and such a frightening time. So I'm going to start by asking you both, how is it you both met? Because it's really hard to find the right therapist, isn't it? It's really hard, but obviously you were a perfect match. So I'm going to ask Kaly to tell me how you met.
Oh, well, I would say destiny, first of all, because Cris was, not professional above that, and human as well. We met through a friend that was one of the first persons that realized that I was in great suffering and I was suffering a lot. This friend knew Cris from São Paulo, I think, back on the days, I don't know, a charity or something, they worked together. I don't remember. But this friend told me stories that I personally don't remember. It's very foggy in my mind. But she said that I was not speaking much sense. She realized I was in depression. And she said, I have this good friend. You could have a chat with her. At first, I was like, okay, yeah, I don't feel normal. I need somebody to make me normal. That was how we met, wasn't it, Cris?
Yeah. It was through a common friend. I received a message saying, Cris, can I give your contact to my friend who's going through a very difficult moment in her life? I said, yeah. And then after a few days or weeks, I don't remember.
I think it was instantly. I think it was.
Was it? Okay.
It was desperation.
Okay. And then Kaly contacted me. Yeah.
And at what point, because you very, very kindly shared your journey and you explained that you had pre-eclampsia, you were at the hospital, they thought there was something wrong with the machine. So you were turned away at one point?
Yeah, basically, well, I had symptoms. Unfortunately, it's a disease and is that it happened to many women, majority of the time, unfortunately fatal. Because I remember doing, as I said, many pre-birth courses and talking to other women. Nobody ever mentioned pre-eclampsia to me. I didn't know what it was. A few weeks before the baby was due, unfortunately, I started having a high blood pressure. I thought I was nervous because she was late about 5 days and, my blood pressure was really high. I remember the midwife that saw me telling me like, oh, it's normal. It's fine. You're probably just a little bit more emotion. She's asking me questions. How you feeling? I said, well, to be honest, I feel great. I was feeling great. I had an amazing pregnancy. Fantastic. Full of energy, full of power. I never felt so good in my life. So she was like, yeah, it's very high. Let's check you tomorrow. Again, very high. And I was like, wow, this is great. Anyway, the baby was supposed to be induced. She came a day earlier of the induction and I was at home. Everybody was waiting for her. We were ready and my water broke. I went to the bathroom. I had and I was like, oh, this is not normal urine. This is not pee-pee. This is something else. So I went outside very shy, because I was like, oh, I think I have something going on. And my mother, yeah, you have something going on. And so 8:00, I went to the hospital and I was walking to the hospital and I was like dressed up, laughing. I was like, nah, this baby's not going to come now. I'm just going to go in. I arrived there. I saw some other pregnant women that was in the course with me, got in and they checked my blood pressure. And they were like, this is not working. It's not possible. Let's go and get another one. So they went there, got another one, came back with another machine. The lady was laughing because I think she was very young. I don't know her age, but she looked like she didn't know. She never had to do with that. She never had experience with this kind of disease. And she checked my blood pressure and she was like, nah, this machine is not working. And no one of the 3 midwives that checked me up understood what was going on. Was put into a room and left there like a normal labor, which was a normal procedure. Everything was fine. If it was a normal labor, it was not. I started dilating straight away. I was waiting for a bed in the other side of the hospital to go and get assessed. In the meantime, I was at very, 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 very high risk. Unfortunately, later on got transferred to the other aisle. My papers, I don't know what happened to it. It got mixed up. They got me there. They put me in a room and nobody checked me. Basically, I arrived there. I was there with my mother and my husband in a lot of pain, having contractions on top of contractions constantly. I was there. And then my husband took me to have a bath. He tried to help me in the best way that he could and experience himself. My mother started getting very panicky and said, this is not normal. She's no, there's something that's not right. But my mother couldn't speak English, so she couldn't do much. So I think it was about 8:00. I literally went on my knees and I begged my husband, please get help. I can't do it anymore. And he was shocked because I always been a super strong, super tough lady, a survivor. So for me to do that was like something was going on. So I get help. The midwife came and she checked me up and she started shaking her head, in despair and say, gosh, you've been 10 centimeters for hours and the baby turned her head. So when she said that, I was like, what do you mean my baby turned her head? She was in perfect position 2 days ago. And then the nurse came in and started literally making signs to her without kind of trying not to make me nervous and just like, we gotta go. And from there, they just grabbed my bed and started running inside the hospital and ringing. And I could hear bells and people coming inside the room all the time. So they got me in a room and this amazing doctor. I mean, she saved my life. She told me, look, this is very serious. You're having a pre-eclampsia. We got to work on you and we got to have time to turn the baby. We need to get this baby out as quick as possible. And I was like, what do you mean? We're going to try to turn the baby. She said, when you have a contraction, I do not know the scientific name, but she said, I'm going to have to try to put my arm inside you and try to turn this baby. And I was like, okay, go for it. I wanted to survive. I was like, no, I gotta do this. So it was without anesthesia, without nothing.
Oh, wow. You had no anesthetic, no pain relief. It has emergency. It was to save your life and your baby in that moment.
She was desperate. I could see in her eyes that she was like, stay with me. We're going to get through this. And she said there was a team and there was a lot of people coming through and at the same time, like doctors and nurses. And I think that when they say that is an emergency, I had about 15, I believe, I don't know, because it was all very foggy. All this came out after therapy and my memory was very foggy. But it was about 15 people. Everybody was coming in trying to help. Everyone was like, they come in like superheroes, those guys. They were amazing. At the same point, they were trying to do blood tests. They were trying to figure out what was going with me. I think that this doctor, she's been very, very human. She was just experienced because I was to a point that they couldn't do anything anymore. all tests could be done. My blood would come out of, they try, I think, 15 times to get blood out of me. The blood was just coagulate straight away. The heart was going too much. Everything was just like, okay. So at that point, this doctor was with me in my hands trying to save my life. And she just said, okay, we're going to go. I remember that very specifically because right now I feel like crying. But she said to my husband, say, okay, we're going to take her to the surgery room. We're going to take her there. We'll try to save her and the baby. If she dies, we'll take the baby. So I was like, okay. And my mother was there. And I remember she said to me, like, you go and you come back. And I was like, I will.
Kaly, you survived. And it's amazing you're here to tell everybody that you survived and you can survive.
Goodness me, when I saw that baby, and I do have to highlight that those people, those emergency doctors, they are superheroes, because I remember her telling me, listen to the music and stay with me. You stay with me. Yeah. And I did that. I was like, okay, it's the two of us here. We're going to do that.
Okay, let's take a pause there. I personally believe that health is the most important form of wealth, and it should be free at the point of need for everyone on the planet. We're therefore fundraising for NHS Charities Together and hoping to raise £10,000 per year through this podcast. NHS Charities Together currently fund over 4,000 projects to support staff and patients to build a brighter future for the NHS. Find out more from our fundraising page in the show notes. This podcast is free to listen to, but we recommend a one-off donation of the cost of your therapy session or anything you can afford so we can reach our £10,000 target every year to support the NHS. I've donated the price of my therapy session, and my company will continue to sponsor this podcast and fundraise for the NHS as long as we're able to. Please rate, like, share and subscribe to this podcast to spread the word. If you would like to sponsor us or feature on the show, please email info@breakingthroughtherapy.com. And so I think from what you said, 7 months later, you worked together. Cris, what do you remember of Kaly's symptoms? Like, how was she presenting to you when you finally mustered the courage to talk to somebody? You knew that things were not right and you didn't feel like yourself. Do you remember, Cris, what Kaly's symptoms were at the time?
Yeah. Kaly had been a survivor her whole life. She was this warrior. So she couldn't complain. She didn't have time to complain about things in life. And she didn't have time to be in touch with her pain, because being in touch with her pain would mean that she would have to let go of the armor that she was wearing for so long to protect herself from suffering, from being in contact with her feelings and all that happened in her life. She was very fragile. She had a lot of symptoms related to depression and trauma. And there was a sense that she was not normal. She would like, I'm not normal. Why am I'm not normal? And part of the therapy at the very beginning was to say like, well, but if that happened to a person, it is normal to feel like that. There's nothing wrong with your reactions. That's not a problem. The situation was very traumatic. So to let her know that she was not a problem, I suppose was like one of the first important interventions, to let her know that it was okay to feel the way that she was feeling. There was nothing wrong with that. Yeah. And in her depression, that was a lot of doubt about her capacity to be a good mother and to feel okay, to feel like she was capable to have a good life for herself. So there was some like risk assessments at the beginning to kind of see how we could work together, and if Kaly needed extra help or not, how we could go about it.
And when you say wrong reactions, Kaly, what did you remember from that time that you felt was wrong and how you'd responded to giving birth?
I used to feel that my emotions were all muddled up. Like, I was happy that I have a baby, but I was not happy that I had a baby. I was not happy, although it was meant to be. And in my head, as you know, I'm a warrior, I'm a survivor. So in my head was like, I got this all figured out. The baby will be born and my emotions will be in place. I was all muddled up. I was not happy. I was angry. I was upset. I wanted to punch the walls, and things start to scale to a point that I was like, oh God, do I want to be alive anymore? Do I go by myself? Do I take the baby with me? I was like, can I go through this pain? Is this pain bigger and greater than me? It was very, 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 very overwhelming, I would say. If I could use one word, I would say overwhelming.
And the people listening who are experiencing postnatal depression, Cris, what is a support when you do a risk assessment? How do you support someone with those thoughts that, they'd be better off if they weren't here, if they'd never had their baby?
Mm-hmm. Yeah, well, it's such a delicate moment because there's a hormonal imbalance combined with the story, combined with the narrative. So we have to be mindful of the importance of have a more robust support for the mother. So it's like, what do you have as a social support next to you? Is your husband a good support? Do you have family close to you? Who can you count with? And when you're feeling tired or when you're feeling overwhelmed about it, the other thing is to see, can you talk to your GP? Can you talk to to see how can we create a more robust support around the mother? And then also every session, I believe at the very beginning, every session, I would kind of gently assess Kaly and ask, how do you feel your thoughts are in relationship to you and your baby, right? And then also to allow her to have kind of a flexibility. So I would say, if you're having an overwhelming week and if you need an extra session, let me know. Text me, send me an email, or if you're having a difficult day and you want to send me an email to share what's going on, just send me an email. I won't reply maybe immediately, but I will read it. And also sometimes it can be valuable to offer some 24/7 support that the NHS and other charities can offer too.
And how did you experience that? Because risk assessment, it can be a scary kind of process, isn't it? And clients can be put off, can't they? That if I tell you what I'm really thinking, you're going to report something or tell someone, break confidentiality. How do we keep you safe but still be open about risk and still share, information with people that need to know to keep you safe?
Let me just add something, Esther. Kaly was in physical pain for a long time too. And that I understood as a huge factor in her mood that was impacting on her mood for a long time because of the consequences from the traumatic childbirth. She was in pain, in physical pain, not only emotional, for a long time.
Yes. Unfortunately, my baby was born with forceps and she had to come out quickly, as I mentioned before. I had a fractured on my tailbone. There was pain for months and months.
One of the things that I understood is that as the pain would kind of subside, she would feel more empowered in her position as a mother, because physical pain, when you're breastfeeding, sleep deprived, there's so much going on, adding pain for weeks, months. It's really difficult. So that was kind of also in my assessment, there's a factor here that we have to count, that it might have a kind of a big impact in her depressed mood.
It's unbearable, isn't it? It's already a huge physical toll, hormonal. Your life has changed. For those of us who have a healthy birth, your life is altered completely when you have your first baby, let alone to go through the trauma, you and your baby nearly not making it, and then also the physical.
I remember that I was very scared. I was like, oh gosh, who is this person? Can I trust her? Can she know me? What she's going to think about me when she knows who I am? Am I a monster? Am I a mother? Who am I? And it was so much emotions. And, it was like, as you said, it's very difficult to go to somebody and tell them, look, I have suicidal thoughts and I have a baby with me. So you're scared because you'd be like, are they going to take my baby away from me? I mean, there is so much. There's so much emotions. And I think that a lot of women go through suffering alone. And we as a mother, we protect our babies no matter what. We protect them and, and my baby first, a lot of mothers would say. And in that case, a lot of women, I think they don't speak because my baby first. And if that what's going to happen when I speak, when I share who I am, what am I feeling at this moment of my life?
And so how could you trust Cris? If there are any psychotherapists or other therapists listening, how did she get your trust? And how did you then feel that you're not a monster and that this was a natural, reaction to abnormal circumstances?
I felt a lot of compassion, a lot of understanding. I could see in her eyes that she's being truthful, that she cared about me. that she could hear my story, that she was not shocked about what I was telling her. I felt supported. I felt very supported. I felt that I was not doing that road alone, that I was going through a lot of pain, and that was painful in all aspects. But I felt that I was not alone. As Cris mentioned, every time we'd finish a section, she would say, like, call me, send me a message. And there was weeks that I would send messages, and there was weeks that I would send an email and say, look, I'm feeling very bad. Is this, again, I would use the word normal. Is this normal? You know, I was so disconnected to reality that I was trying to figure it out. Like, is this what other people go through? Like, yeah, I just wanted to fit in. So I was like, is this normal? But yeah, I felt very supported. I felt really supported. And as a mother, vulnerable, I think that was life-changing support and compassion.
And so did you work together online or in person? And how many sessions did you have?
For the first part, it was all in person.
Mm-hmm.
Later on, we changed it for online. Yeah.
And what year was this and how many sessions do you think you had?
I don't know the number. It's so funny because whenever I write my notes, I always put the date and the note, but I never put the number of the session. I should do that from now on.
But when your daughter was born, roughly what year was that?
2018.
Okay.
Yeah. So I was in and then out of therapy, and then I came back to therapy again when I immigrated to Italy. So yeah.
Okay. And I think that what you said was amazing, Cris, because I can see how Kaly experienced that as compassion and understanding and warmth and your availability. How did you manage to be available whilst maintaining boundaries? I think therapists find that really difficult because obviously, you know, we do have strong feelings for our clients. We do think about them outside sessions. You can have a really strong connection, or you could have been through something very similar to your client. But how do you do that? Make yourself available whilst also keeping boundaries like that?
It's tricky. And I feel that during the session, this process of being present with a kind of a compassionate, active listening there kind of allows the relationship, the therapeutic alliance to be created and to be cultivated. So whenever Kaly was going through, especially at the beginning, I felt it was important to let her know that there was some availability, that she could reach out, but that I might not reply immediately. Like if you need immediate reply, we have like NHS and other services. But if you just want to reach out, if you feel that it's reaching out to share a difficult moment, you can email me. I will reply, or you can text me and I will reply. I'm not going to reply immediately, but I will do it. And one thing, we have to be mindful of offering something that we really can offer. So I knew that I couldn't offer immediate replies, but I knew that at the end of the day, I would look at my emails and I would look at my texts and I would be able to say I see you, I read your text, and then see, do you want to have an extra session? Or was this just kind of a space for you to express yourself? And that's fine. So yeah, it was like kind of being very conscious of what I could offer. So the trust would be also kind of there.
That's great. Thank you so much for that. So Kaly, if you had to say 3 breakthroughs you made in therapy, what would you say they were?
I would say having a curious eye towards me, who I am. As I said, I lived many years as a survivor. So turning this curious eye to who I was, it was like, oh. And I remember 2 specific things that I couldn't do was look at myself in the mirror, not how I was dressed, how was my hair, but truly look into my eyes and look at myself in the mirror. And the hug was one of the hardest things I could do. So once I managed to give a hug and I managed to look at myself in the mirror, I was like, hi.
Do you mean hug yourself or?
Yes.
Oh,
yes.
great.
Or any other person. I would hug people, but like, hey, hi, I wouldn't truly, honestly open my arms. That was too vulnerable. That was too much. No, I can't hug people, So that was definitely, and the curious eye and like, oh, I like this. I like that. I think that when you live in survival mode for so many years, you go to amazing places, you travel to fantastic countries, you do so many things, you don't live those things. You're there. I'm just ticking the boxes, but I think that, when you're like, wow, I remember my senses were all messed up, I couldn't hear anymore. I couldn't feel anymore. And when I start really hearing the world and hear what's going on, even the bus passing downstairs or the birds, I was like, oh, they are birds, it's like if suddenly I lay there and then I woke up again, literally whoa, this is a planet. There are things in here. There are flowers. There are people. There are new people. That for me was like, whoa, I'm alive.
That's amazing. That sounds like a mindfulness technique, which maybe we could talk about a bit later. What would you say the second breakthrough was for you?
Being a mother, being able to give love and feel loved. I think you can't lie to a child, you can't pretend with kids, you can't, you must just go, boom, it falls down. Here I am naked and, you can see everything, all the layers of me. So I think, that definitely being able to accept that love and give love, to my family, to my babies now, my husband, feel that love and, feel that I did not deserve, but I can have that love. It's mine. I can have it. I don't need to repel it anymore because it doesn't belong to me. I know I can't have this, whenever, I would feel like this is not for me. This love is not directed to me. A compliment is not for me. So, once I got to that point, it was like, wow, this feels amazing.
That's so powerful. That self-love and accepting love and being appreciative or knowing that you deserve love. That's really huge. And one more before I ask Cris what other breakthroughs she noticed.
Professionally, I'm a chef. I always say that when you're creative, you shut down anxiety. So in the kitchen was a way, I think through my past years was when I was truly alive. It was in the kitchen, although there was a lot of sentiments, a lot of anger, sometimes. So, but professionally, I could, so many times I would create those amazing dishes and people would come to me and say, wow, chef, this is fantastic. I'll be like, yeah, but, very critic. This is not good. Okay, move on. Let's create something else. Let's do something else. This is not right. So yeah, appreciate my work, appreciate my talent, appreciate what I was doing, in profession, which was many years. I did so many amazing things and I didn't see them. I didn't recognize them. I didn't appreciate them fully enough because whenever I would get a compliment, it's like, nah, not talking to me, cannot possibly be, so.
It's so powerful hearing you speak. And I was wondering, because we've met a few times before, and something about the inner child and the inner critic. We wanted to talk about some really powerful techniques because I can really hear that you've turned everything around. You talked about literally not being able to hear or see or feel, like that numbness, that death, the living dead. That is such a powerful way that you've evoked that emotion. And to come from that, from the point of almost having lost your life to then really living life to the full. For our listeners to understand how that happened, I wonder if it's something to do with the inner child and the inner critic.
Yeah. Yeah, we did a lot of inner child work. Yeah, we did. It was not the beginning of it. So the beginning was kind of stabilizing and kind of some cognitive behavior strategies, psychoeducation, letting Kaly know that, when people go through trauma, these are common reactions and it's okay. So that was the first part of the therapy, was going through this traumatic experience and processing it. And then using also some emotional regulation and learning about mindfulness practices, about breathing exercises. So it was, and in between sessions, often I would suggest some homeworks I would go, right? So it would be I want you to observe how you feel when you go for a walk in nature. I want you to tell me, how did you experience this? And instigating this curiosity for her experiences. So that was often kind of homeworks that I would suggest. And Kaly would always be for them. We would always be there for the homeworks and do them and enjoy them. And the other part was in between, exercising, self-regulation, learning how the brain works, how the mind functions, and how she can get to know herself. It was also kind of helping her to be more in tune with what was joy in her life. So that was kind of creating the courage to be able to then go deeper again. It's like doing those kind of diving. You go for a deep dive and then you have to go back to the surface. You have to kind of like enjoy and float and feel like, oh, okay, that's nice. Oh, that's who I am. Oh, okay. But that happened. Okay, let's dive again. And then we would go for another dive. And that was the part of the inner child work where we kind of Kaly revisited her childhood. And then we worked on some other traumas. And that was a beautiful experience because she really kind of, she created this beautiful relationship with her inner child. And she would like tell me during the sessions, like, oh, I talked to her. Oh no, I went for a walk and I took her with me and we kind of had a conversation. And that was so beautiful how she really kind of embraced that to be able to integrate herself and to feel more who she was and who she is. Yeah.
I think, honestly, it's phenomenal hearing you describe this because, you see integrative psychotherapist. What does that mean? But what you've done so beautifully is map out how you've literally worked from the brain and the mind and then outwards, you're talking about a cellular level all the way out to working with all the systems that we find ourselves in. So you talked about the brain and psychoeducation and then using cognitive strategies and the homework and then mindfulness. And then at that point, when the stabilization has happened, you feel that she's getting somewhere with the therapy, then you can do the deep dive into the childhood and the inner childhood work, which is really nice, I think, for our listeners to hear that, how many skills, but also how you gently introduce the client, like based on where they're at and what they're ready for, and build that relationship up first. So that was so helpful. Thank you. Okay, that's food for thought. Let's take a break here. Come and have a free 15-minute consultation with one of our incredible multi-award-winning practitioners at Lifespan Psychology, the Diverse Practice. We're a multicultural team of doctorate-trained psychologists, psychotherapists and counsellors offering assessment, evidence-based talking therapy, coaching, training and consultations. We now also offer ADHD assessments in person and online. We work with a range of corporate, commercial and holistic companies and accept private medical insurance, referrals from the NHS, social care and rehabilitation companies. We also offer a range of fees for self-funding clients. Contact us at info@lifespanpsychology.co.uk or www.lifespan-psychology.com and follow us on our various social media channels in the show notes. Our clients at Lifespan Psychology are our true award winners. We're here because of you, we're an award-winning team because of you, and we're inspired to be the best that we can because of you.
I would like to add that during those sections, while we're working on those deep waters, I would relate to as you use, Cris, I still had to live in that world. I still had to go to work. I still had to be a mother. I still had to do everything else. So though we were doing this deep work, with this rescuing this child and loving this child, I still had to be in the world out there. And Cris was fantastic of helping me to balance this out. Although I was giving love to my inner child and taking care of her and, making her feel safe, I still had to go out, go to work, see other people. And I think that being given the tools to work with that was just fantastic.
Well, that's so helpful. Thank you so much for that. Was there anything more you wanted to add about how you work together? Because I think one area we haven't talked about is how you then improve like the attachment with baby. Because obviously you went on to have a second child, which is amazing. But lots of people don't feel able to, and it's understandable that people decide not to. One of the main things maybe for our listeners is it's amazing you found that self-love and that confidence, your passion for life and your work came back and your love, you were able to receive and give love. But how do you bond with your baby after a traumatic experience like that, Kaly?
I think that once we worked different aspects in me and I learned to love myself, I could love that baby. Once I felt love for me, I also could love her because I was loving her in a mother aspect right when she was born. I was like, okay, I'm your mother. I got to take care of you. I got to fix your gender. Once I understood that I could love myself, that I was valuable, that I was worth loving, then my heart just opened, and then we connect. Then we connect, and we connected. we still emotionally regulate each other. She regulates me, I regulate her. Especially baby was so helpful when I had my second child. That baby was, my daughter was so helpful when I had my second child now. I remember thinking a lot about her, and she gave me a lot of power. I regulate myself and I regulate my emotions, and I was able to connect with the baby and love that baby. Then I had the strength of having another baby and going through the risks of having another baby, because I did have pre-eclampsia another time. I was going to say in Italian because I had the baby in Italy.
That's incredible. Your first baby gave you strength to have your second baby and empowered you. And through that self-love and love of her, you were able to give again, even though you had pre-eclampsia again.
Yes.
And this time you said the birth was actually a lot better, I think.
Oh, the birth was fantastic. It was fantastic. It was just like, oh my God. Obviously, after doing therapy, I was free to speak. I am not in survival mode anymore. I don't have to hold the pain. I don't have to hold my words. I can speak. I have a voice. So going through all the tests and everything through pregnancies and with my doctor, my gynecologist, and I told them, look, this has happened. I'm not saying it's going to happen again, but you will be prepared in case it happens. And my doctor, absolutely. We worked through everything. And I did seek for help. I seeked up in the hospital, out of hospital. I didn't mind if I had to do 1 million tests. I had to do blood tests every week. Doesn't matter. I want to be looked after. I feel safe by getting looked after. Yeah. So I was like, okay, I this is so walking in. I had my baby in 24 minutes. It was magical. The doctor I'm trying to remember the African song of the Lion King. Yeah, it doesn't come to my mind now.
The Circle of Life.
Circle of Life.
Yay.
Yes, and I arrived in that room and I was like, she asked me, do you want to go into bed? And I was like, no, I want to give birth to this baby on the floor. And she was like, here we go, girl. And I gave birth to her on the floor, and it was just amazing. And the sensation, I felt connected to Mother Earth, to Earth at that point, when we were on the floor, and it looked like we're having a picnic, but it doesn't matter.
So birth was a picnic the second time round. Everyone listening, this is going to be very encouraging for them.
It was like, oh my goodness. Obviously we are all aware. We all knew what game we were playing. The doctors were ready. They had we all know, whoever is listening and had preeclampsia know that once you deliver the baby, the placenta has to come out really quickly, because that's what causes that issue, that problem. So as soon as the baby came out, the doctor looked at me and was like, we got to get the placenta out very quickly. Let's go for it. So it was not, although it's so beautiful, we knew we were on our job. We were there, we had the job to do. So I was like, okay. So my husband got the baby, and he was like, do you want me to stay with you? Should I go to the baby? I was like, no, you stay with me. We stayed there, and I got the placenta out, and she said, do you want to see it? And I was like, yeah. And I don't know if anybody experienced that, but they are massive. Whoever has preeclampsia, the placenta is like a tree. So I was like, great, you're done. And then, from there on, I was like, it was just amazing.
I'm just so happy we got to record now in 2025, because when we were going to record last year, we wouldn't have known. And you were still so brave enough to want to do it in your pregnancy, your second pregnancy. But you had that belief, didn't you? You knew you could do it. And now we've proven that. And that, I think this is the power of therapy, that you had those tools.
Yes, I was going to say that. I don't think that if I have not done therapy, I would have been able to have another baby. I don't know if I would be here. So I think that therapy gave me that power, that curious eye about myself, what I'm capable or not capable of doing, and, ask for help. Because I think that when we live in survival mode, we don't ask for help. It was just fantastic. And I was funny because I mentioned to my husband, if I knew it was this great, I would have had before.
How long did you wait for number 2?
6 years.
Yeah. They're giving you time to heal.
6 years to heal, to feel. And I remember just before I get pregnant, I remember that Christmas, and I look at myself, I look at my body. I was looking great, hair was looking, I was like, oh, I look good. That's great. So when I got pregnant again, I was like, what? Here we go again.
Okay, I'm just so sorry that we have to end our conversation soon because I've had an amazing time talking to you. I could talk to you all day.
Oh, me too.
Cris, if anyone wanted to connect with you for some therapy sessions for birth trauma or anything else really, because I think you're exceptional. You work with a range of clients, don't you? How would they get in touch with you?
I have a website. It's www.vitalcompass, but with a K. So KOMPASS.com.
Great. And I will put that in the show notes. And if there are any resources as well.
And there's Instagram also. It's Vital Compass, again, the same.
Instagram. Yeah. Okay, brilliant. And was there anything you wanted to say before we say goodbye to our lovely listeners?
No, but it's just that I do feel that it's such a privilege to be a psychotherapist, to be able to participate in people's lives in this way, with this role. And even though I'm not Jungian, I'm not a Jungian analyst, I do think that Jung said something very meaningful and very beautiful about psychotherapy. He said to know all the theories, to master all the techniques, but as you touch a human soul, be just another human soul. And I feel that this is what we know the techniques, we learn how to apply them. The techniques are there for a person. So how can we connect with this person from this place of just sharing our humanity? And then we'll move from there.
And on that note, I would love to hear from anybody listening who this has had an impact on them, and just love to hear their feedback, because we don't always hear from anybody listening. But it'd be really encouraging to know that they've listened to your story and it's given them some knowledge or kind of empowered them or given them some hope that things can improve. They can get the help they need. They don't have to live, post-trauma in a really depressed state, unable to, get help, that there is help out there. So anybody listening, do email me at info@breakingthroughtherapy.com. I'd love to hear from you.